Hi everyone, Dr. Angela here with you. Welcome back to PrettyWell. The focus of this video is seasonal affective disorder, aka SAD, winter mood funk, winter blues. Essentially, seasonal affective disorder is a type of depression that occurs during the winter months. So it can come on as early as September and last all through the winter, through the spring till about April for people who are prone to seasonal affective disorder. It doesn't always look like crying or sad mood, even though we think about that with depression. There can be all kinds of symptoms associated with seasonal affective disorder. It can be something as simple as, or as subtle as even, change in your concentration. Just generally feeling more fatigued, even though you haven't changed anything with your supplements, your diet. Maybe you just have less motivation, or you are feeling really tired all the time and maybe even a little achy, but then you're having difficulty sleeping. Feeling more introverted, like you just want to stay home and watch movies and be in your pajamas, not see your friends as much, changes in your libido, changes in your appetite, maybe wanting more food, maybe wanting more sugary, starchy food. So all of those kinds of symptoms can be associated with seasonal affective disorder. Who gets seasonal affective disorder? Well, anyone can get it, but for the most part, women are actually far more likely to get it than men. 3/4 of seasonal affective disorder cases are actually women, so it's a pretty high statistic for women. Anyone who has a family history of seasonal affective disorder or even depression, anyone who personally has a history of depression, anyone who's had seasonal affective disorder in the past. So lots of things that can set us up for more seasonal affective disorder. There definitely is an association between the change in light and the symptoms that come on with seasonal affective disorder. So the decreased light hours in the winter months are a huge trigger for this type of low mood and other depression symptoms that come along with seasonal affective disorder. So what can we do to minimize our chances of experiencing these symptoms if we're prone, if we just struggle a little bit more in the winter months? Well, thankfully, there are some really effective natural therapies that we can do for seasonal affective disorder that tend to work pretty quickly. The key is to do them, because it's harder in the wintertime when, if we're already experiencing less motivation, it's really hard to get ourselves into a routine. But these are the things that will help us to feel much better quickly. I personally am very prone to seasonal affective disorder, and it was making me laugh because I was, just the other day I was like, what is with me? And I was just like, oh, right, winter, that's what's with me. I've had many years where I've had seasonal affective disorder, and I'm not always affected. It definitely is exacerbated if I am out of my normal routine, if there's certain things that I'm skipping on that really help my mood in general. But it's funny because I'm a doctor and I do this day in and day out. I help people with their health all day long, and I'm very clued into the symptoms of depression. And then sometimes, when things are happening to me, I'm just like, what's happening? Right. And so if I'm struggling, recognizing some of these symptoms, I feel like we could all use a hand with awareness of the reminders of what those symptoms look like and the things that we can do to make sure that we're not struggling. Depression is one of those topics in general that there's so much stigma attached to still. We have a really hard time usually letting people know that we're not feeling okay, that we could use a hand. And so it's kind of one of those hush topics still. Thankfully, there's been more and more awareness over recent years, and a push to kind of talk about things more with each other, so we don't struggle in silence. But still, this is an area where we could use a lot more support than we typically get. And just to remind ourselves too, to reach out and ask for help with our trusted friends and loved ones when we are struggling. But these are some tips that you can use if you are struggling with seasonal affective disorder to really alleviate the symptoms pretty quickly. So this type of depression is triggered by the decrease in light in the wintertime. So one of the most effective things we can do is increase the light exposure we get. So starting with the morning hours, going out to sunbathe if we have time in the morning, or even to have our coffee, tea, breakfast outside in the morning on our porch, in our backyards. If we have time to exercise in the morning, that's ideal, because exercise, we'll talk about in just a moment, but exercise is also highly effective at raising our moods, and then we'd have all of that sunlight exposure while we're exercising. So trying to get light in first thing in the morning, outdoor light in first thing in the morning. The other thing to do is to buy a home light therapy box. They're very inexpensive and they're very effective. Within 2 to 3 days, you can start to really feel the improvement from the phototherapy box. You can find them very easily on Amazon. I'll put a link in the description box. I just ordered one. I've had them in the past, and then, again, different years, like I haven't needed them. And I was just like, oh boy, this year something's going on and I could really use that light therapy. And so very easy to order. And then we can just have them on our desks during the day. So when you're doing any of your other paperwork or anything on your computer, just alongside your computer or your device, just having the light therapy box, you can have it with you anywhere throughout the day that you're going to be for 30 minutes or so. And again, relief happens for most people within 2 to 3 days, and within 2 weeks, most people have profound effects. So 60 to 80% improvement for most people using light therapy boxes. So increase the light in any way you can, both outdoor natural light and with a light therapy box. The second thing to do would be to make sure that you are having a healthy diet. So really making sure you're having enough protein, healthy fats, and hydration. The amino acids and proteins are going to be building blocks for all of the good neurochemicals in your brain. And then, the brain really needs a lot of essential fatty acids and healthy fats and hydration to function well. So that's something to do to really set yourself up well. Exercise is key in terms of increasing our good mood chemicals, our neurotransmitters, our endorphins. So circa 30 minutes of some kind of aerobic exercise, ideally outdoors, would be great. But if you can't do the exercise outdoors, still get yourself outdoors in the morning and then figure out exercise some other time in the day. The key is the commitment, because usually we're not feeling as energetic, and so exercise can be harder later in the day in the winter months because we're not as motivated. So if you're gonna opt for later in the day exercise time, making sure you absolutely commit to that. The other really effective area to help us with seasonal affective disorder is supplementation. There's a few key supplements that really help with seasonal affective disorder. First on the list would be vitamin D. When we're outside in the sunshine, we make our own vitamin D, but again, in the winter months, we typically have less exposure to the number of hours in the sun, so our production of vitamin D can be less. So supplementing with some vitamin D can be extremely helpful. Anywhere between 2,000 and 10,000 IUs. You can have a baseline of your blood work done with your doctor to figure out where you're at, and then safely supplement with vitamin D. You can supplement with vitamin D to begin with, even if you haven't had your blood levels tested, but at some point good to just spot check your baselines just so you know where you're at. And then you can take an amino acid supplement, which is going to give you the building blocks of all of those healthy neurotransmitters. If you're in dire straits and your mood's gotten really low, or you're just having severe symptoms, some of the other symptoms that go along with seasonal affective disorder, definitely recommend trying herbs, aminos, and vitamins that increase your serotonin in your body. And so there's different ways of doing that. You can take St. John's wort, that's an herb. You can try SAMe, you can try tryptophan, 5-HTP. All of those will increase serotonin. which typically plummets in the winter months for those who are suffering from seasonal affective disorder. Something to say though, if you were already on a prescription antidepressant medication that affects these pathways, so an SSRI or an SSNRI, this would be a time that you do not use any of those category of the serotonin increasing or enhancing supplements, because you can have negative side effects. So one or the other. If you're not on a prescription antidepressant that affects the serotonin pathways, do try some of those supplements, and I'll put them in the description boxes for you guys so they're easy to find. But if you're already taking a prescription medication, that would be a category to avoid. But you could still do the vitamin D, you could still do the aminos. The other area that is really helpful for mood is omega-3 fatty acids. And so most of us know those as fish oils. If you're vegan or vegetarian, you could also do flax oil or seaweed oils to get some omega-3 fatty acids. So those are immensely helpful for us in terms of mood. And then always a good idea to take a high quality multivitamin mineral to get active forms of B vitamins and minerals, which are cofactors in the reactions that help us make all of our good mood chemicals. So those can be really, really helpful. And I'll put those in the description box for you guys to find easily. So the other area that I think is underappreciated is sleep. When we undersleep, this has a dramatic effect on our mood. When we're underslept, we tend to be far more pessimistic, negative, hard on ourselves, we ruminate. And interestingly enough, with seasonal affective disorder, oftentimes our sleep cycles are affected. So getting adequate sleep, figuring out whether that means 7 hours, 8 hours, 9 hours for you, making sure you've had adequate rest can really be a wonderful modality tool to really increase your mood, increase good mood. So those are some very effective tips that you can naturally integrate into your lifestyle that can really help with seasonal affective disorder. Wishing everyone out there who's struggling with some winter blues quick relief. Share this with a friend if you feel like it would be useful for them. If you've tried something else that was helpful for you, please feel free to share that with the community as well. Thank you everyone for being here. Loving watching the community grow and all of us learning from one another. See you back here next week. Take really good care.